10, where you live could determine whether you survive an emergency. If you live in a rural area, you might not get an ambulance in time. That's the case for several smaller Iowa communities, including West Branch. KWWL's Elizabeth Amani traveling to West Branch earlier to talk with EMS leaders. She joins us live in the studio with more. Elizabeth.
Mac, I spoke with a woman who's not only a volunteer first responder in West Branch, but she's also a paid paramedic with Johnson County, giving a unique perspective on how volunteer departments are now tapping in to urban areas simply because those resources aren't there.
People think that they're guaranteed an ambulance when they call 911.
Volunteer West Branch first responder Sandy Hike knows that to not be the case for rural Iowa. Just last year, West Branch had a total of 346 medical calls. That's more than 4 times their call volume for fire-related calls at only 80. Yet Hike says their first responders aren't able to transport to the hospital, forcing them to tap into surrounding area resources like Johnson County, where Hike also works as a paid paramedic.
We're seeing a lot more where we're having to go out and respond for these rural services that aren't responding or having delayed responses.
So then the question becomes, why are they struggling? Hike says part of the problem is recruiting volunteers.
The volunteers in the past would willing to drop everything and go anytime the pager went off, and the volunteerism is dying because it costs so much to become an EMS person, and these volunteers are having to pay that out of their pocket to basically do a free job.
The Iowa EMS Association says it's a problem that affects a lot of small towns here in Iowa, and in order to change that, EMS needs to be considered an essential service. Treasurer of Iowa's EMS Association, Brandon Smith, says this problem is one they've been working to change at the legislative level.
Rural EMS in Iowa is by word an essential service, but not by the state code. And because of that, there is not a revenue stream to provide EMS in the state of Iowa.
Both Smith and Hike agree.
We got to find a way to fund EMS so that there's a paid person that's going to respond on those calls in a timely manner.
Now, Smith also added the Iowa EMS Association doesn't believe it's efficient to have an ambulance in every single small town in Iowa. Instead, they believe a regionalized ambulance service would be a better system with quicker response times and reliable coverage. In studio, Elizabeth Amani at News 7 KWWL.
Training and certifications for EMS can cost anywhere from $2,000 to $15,000. That's a reason why volunteer departments say recruiting is so difficult.